Are you feeling a little tense and stressed out? How about some needles? Don't worry, I'm not talking about these. Have you ever heard of acupuncture? It involves inserting hair-thin needles in specific areas to treat pain.
Needles in your face, pleasure in your base.
It might look scary, but it really works. But how can poking your body relieve pain? And what is electroacupuncture? This is your body on acupuncture. According to traditional Chinese medicine, acupuncture is based upon the principle that your body contains qi. It's the energy that flows through pathways in your body called meridians. That energy is disrupted when you have some type of chronic condition or disease.
Diagnosis? Puberty.
Placing needles into acupressure points along the meridians can help rebalance your qi. Acupuncture is often combined with conventional medicine. It can treat migraines, lower back pain, and sinus congestion.
I wonder how long it's gonna last.
It can also be helpful if you have nausea, menstrual cramps, or infertility issues.
Jesus.
People also rely on it for general wellness and stress management.
This is the most stressed out I've ever been.
Are there any side effects? Can acupuncture help you give birth? Preparation. Before your first acupuncture session, you should look online for specialists with good reviews. You can also check the acupuncturist's credentials and training. Having an official diploma doesn't hurt, at least on paper, but we'll get into the potential side effects later. You can also speak with a practitioner beforehand to ask them what the treatment will involve and how it will improve your condition. Make sure to also talk with your doctor and let them know you're considering giving acupuncture a try. The session. The session will last about 60 minutes. Your acupuncturist will first conduct an examination to determine which areas of your body are in pain. They will also check your pulse. You might have to remove your clothes for certain sites. Breathe easy, you won't be naked. They will provide a gown or towel to cover your intimate parts. Once you've laid down on their padded table, your acupuncturist will find the appropriate points to insert the needles at different depths. You might feel some mild aching when they gently move or twirl the needles. These needles will remain in you for about 10 to 20 minutes. It's time to unwind.
Just relax with your own thoughts.
The stimulated points will boost your central nervous system, leading it to increase biochemical activity within your muscles, spinal cord, and brain. This will produce endorphins, your body's natural pain-relieving hormones. But the needles aren't always placed near the affected areas. If you have trouble sleeping, the best points would be between your eyebrows. Similarly, the space between your nose and upper lip is a good spot for lower back pain.
My back.
These might be far from their targets, but they are connected by a common nerve.
My fault! I accidentally tweaked his facial nerve!
Stimulating these points can set off impulses through the nearby nerve fibers. Some people prefer electroacupuncture, which involves attaching electrodes to needles for added stimulation. But you might be shocked to know that this can be dangerous if you have a pacemaker.
Oh, Granny.
And while pregnant, acupuncture might stimulate labor.
Do it!
Well, it's a good tip if you're past your due date. After the session. All right, time is up. You won't feel any discomfort when your acupuncturist removes the needles. People respond to acupuncture differently.
I feel really relaxed.
Depending on your reason for the procedure, you may feel more energized or tired afterward. You could also experience some soreness, minor bleeding, or bruising at the needle sites, especially if you take blood thinners. But you could also get an infection if the needles are not sterilized. If they are inserted too deeply, they may rupture your lungs, gallbladder, or your blood vessels. This is why it's important to find the right practitioner. Acupuncture could ease your chronic or episodic pain within a few hours or days, but it might take more than one session for your symptoms to improve. Or it may just not work for you. It's not for everyone, but there are other solutions. The alternatives. If needles aren't your thing, you could try simulated acupuncture. This involves using lasers on acupuncture points. You could also try acupressure. It has similar effects as acupuncture, but the specialist presses or massages the points instead. Hypnotherapy could also be a solution for your chronic pain or anxiety. But do you think you'd be able to handle being hypnotized for 1 week? We'll find out on another episode of Your Body On.